Welcome to Aawaz, Voices from the Field, a podcast series on quality improvement by Nationwide Quality of Care Network, supported by UNICEF India. Let's listen to a QI story.
Hello, folks, and I'm your host, Neelu Suri. Believe in yourself and all that you are. Know that there is something inside you that is substantial than any obstacle. With this quote, I welcome a very special guest, Alisha Shashni. Well, Alisha, very warm welcome. Alisha, tell us something about yourself.
Hello, Neelu ma'am. My name is Alisha Shashni, and I, for the last 5 years, have been privileged to be working as a dedicated nursing officer in NICU of Kalwati Saran Children's Hospital, New Delhi.
That's great, Alisha. Alisha, on which title you are going to share your story with us?
The title is, ma'am, Facing the Challenges Amid COVID 19.
That's great. So it's really an inspiring title. Uh,
Yes.
what were the source of inspiration and motivation that made you to work on this project?
Well, I'm not a person who gets inspired or influenced very soon. And today, if you see me talking about QI projects, stories, that means there is something really sassy about it. And luckily, one fine day, I was fortunate enough to be a part of session in 2018, and there it was for the very first time. When I was introduced to QI projects, I really got inspired there by the QI success stories people shared, the ways they actually worked together to attain, and then they even sustained the changes. And from that day itself, I had it in my mind that I shall also do something in my department for quality improvement.
Okay. Alicia, since the area chosen was very crucially linked to global pandemic of raging COVID-19, what made you to choose this?
Yes, ma'am. It was not really easy to choose one problem out of all the challenges in this COVID era. But I was being posted in COVID ward. From the very first day itself, I found that compliance to BMW was lacking. So I really wanted to work on this topic as fear was on the air.
So you were in the fearful situation and you felt that
Yes,
time that you should work on this project, right, Alicia?
yes, ma'am. Yes, ma'am.
So you
Definitely.
might have felt, you might have encountered certain, obstacle and hindrance while working for that specific project, as your team would be.
Yes,
So what were those obstacles?
there were plenty. Like
Hmm.
the place where we were working was a makeshift ward, that is, which was under construction. We staffs from the other departments and specialities were posted there for the duty, and
Hmm.
scarcity of resources was so much of that. And sanitation workers lacked awareness, education, training, knowledge regarding the rules of protocols of biomedical waste management. And
Okay.
as we all know, fear of corona was in the air.
Yes, that was absolutely in the
Mm.
air. And how did you overcome those, obstacle? And you might have adopted certain strategies or methodologies. What were your tools? How
Yes,
did
ma'am.
you
Well,
identify those specific problems?
various tools were used for analyzing the problem, ma'am. To determine the root cause, we used the fishbone method.
Okay.
And we used 4 Ps. Those are people, process, place, and protocols. Under the
Hmm.
people, we found that they were
Okay.
finding very difficult to empty more bins.
Okay.
And under
Okay.
the process, we found that lack of awareness was there. And under the place, we found the place was highly infectious and really hot because ACs were not being used because of the fear of transfer of virus. And under the protocols, we found that lack of protocols for cleaning schedule was also missing. So these were the some points which were enlisted under the root cause analysis in fishbone.
Okay. So by fishbone method, you try to identify the problems, right, Alicia?
Yes,
Right?
ma'am.
So
Yes.
how did you intervene? What was your strategies of intervention, Alicia?
Based on the root cause analysis, we chose morning huddle. We usually did in the mornings at around 9 o'clock. And this was done basically for our healthcare workers and sanitation workers every day to make them aware, to appraise them about the importance of segregation of biomedical waste, to keep them everybody's motivation high, and to ask them all the questions, whatever they want to know. And this way, we also did it every day. And nursing rounds were also done to supervise, and checklist was also formed. And we also added our patients in this. Regular feedback from different patients were taken randomly over the phone.
Okay, okay. So, what was the tool adopted by you, Alisha, while collecting your findings? You said that through phones, and you kept on appraising them. So, how did you manage to keep alive their interest, especially for the team members who all were working amid the pandemic fear?
Because of the COVID era, it was really difficult because it was a year of social distancing, wearing masks, wearing PPE. So during the morning huddles, also we used to have wearing all these systems alone. And after that, we used WhatsApp group, which was a
Okay.
real good one for us. Ma'am, every day we were in the group, and every day every person used to give their discussion used to be done, deliberations used to be done, suggestions were also given. And
Mhm.
soon we used to also have Zoom meetings, where
Mhm.
Zoom meetings were conducted so that the QI members, all the team members, can do a lot of discussions, and this way we were able to communicate with
Okay.
all the team members.
Okay, Alicia. Alicia, you pointed somewhere about the checklist. What about
Yes.
that checklist, and what special guidelines or you adhere to, and what the special, information or kind of work you have done during that, making that checklist and following that checklist?
A checklist we prepared for data collection, and
Okay.
we had enlisted 10 to 12 points in our checklist, which
Mhm.
had mainly availability of bins of all color coded, then posters are available or not, spill management kit is there or not, BMW logbook is there. So there were many other points which was being kept for checking and having an observation on the department and the housekeeping staffs as well. So this was regularly done by a nurse in the morning, assigned nurse in the morning, so that we can keep an keen observation.
Alicia, tell me one thing, that waste management had been undertaking at what stage of study is it as of now? I mean to say that what were the outcomes?
Initially, ma'am, the COVID isolation ward scored only 10% in terms of biomedical waste management. However,
Okay.
after the initiation of QI project, this score increased to 90% with the improvement seen in the form of availability of all the four color coded bins, white SDU boxes, and display of hand hygiene and BMW segregation posters in the ward. The outcome of this project really was good and satisfying.
Okay, great. Since
Mm.
Alicia, you have become a role model for your institution as well as the people who are listening you, I am really sure. What kind of inspirational message you want to give?
W. Edward, a pioneer in quality, he stated that it is not enough to do your best. You must know what to do and then do your best. It's to all my listeners that I, being a bedside nurse with the help of QI team, have brought a huge change in my department during the COVID era. So what are you waiting for? Let's form a QI team and do our work in better way.
That's great, Alicia. Thank you, Alicia, for being part of this prestigious project.
Thank you, ma'am. Thank you so much.